Good afternoon, good evening, good morning to those around the world and around the country. I am Sharita Berry, and welcome to Complementary and Alternative Medicines Holistic Wellness and Healing Blog Talk, where we cater to the whole mind, body, and spirit of a person. Glory to God, and I want to welcome you on today. Before we move on, I want to let you all in on our what? Our disclaimer. That's right. We have a disclaimer. And the disclaimer goes content on this site is for references and educational purposes and is not a suitable for advice from a licensed healthcare professional. You should not rely solely on this content. Holistic and wellness services and Sharita Berry has no liability for inaccuracies. Always consult with your medical doctor first before you try any holistic and alternative medications and or holistic modalities. Statements regarding herbal supplements have not been evaluated by the FDA, and these products are not intended to diagnose, treat, cure, or prevent any disease or conditions. And that is our disclaimer on today. And today we're going to be talking about comfrey root. Comfrey root. Comfrey root. COMFREYROOT. Comfrey root. Comfrey root is a plant, even though this plant contains poisonous chemicals called pyrrolizidine alkaloids, PAs, the leaf, root, and root-like stem rhizome are used to make medicine. The amount of PAs found in comfrey changes according to the time of harvesting and age of the plant. The roots have 10 times higher amounts of PAs than the leaves. Some products labeled common comfrey or are actually contain the more poisonous prickly comfrey or Russian comfrey spices. Comfrey is used in tea for upset stomach, ulcers, heavy menstrual periods, diarrhea, bloody urine, persistent coughs, painful breathing, bronchitis, cancer, chest pain. It is also used as a gargle for gum disease and sore throat. Comfrey is applied to skin for ulcers, wounds, joints, inflammation, bruises, rheumatoid arthritis, swollen veins, gout, and fractures. The chemicals in comfrey might have a healing effect and reduce inflammation when applied to the skin. However, comfrey contains toxic chemicals that can absorb through the skin. And one of the very most important things about comfrey root. Now, I know I said that people use comfrey root as a tea, different things like that. But I want to let you all know a little something also in reference to comfrey root and why people no longer use it as tea. But I'm going to go back to its uses. And I want to welcome everyone on today. I am Sharita, and today we're talking about comfrey root. And why people they don't use comfrey root as a tea any longer, but they use it, when for wound healing. As I stated, for like if you had a sprained leg or you may have something going on, back pain, um, bruises, broken bone, pulled muscles, like we said, varicose veins, um, and different things like that. Inflammation, pain due to swelling. But we all know that more information is required to make sure that, when we're reading on herbs and herbal supplements, we always want to make sure that, you do your research. You look up literature reviews, you look up scientific studies. A lot of herbs nowadays have some scientific studies. Some, are limited. Some have literature reviews. Some are limited. But you have to do your research when it comes to any type of herb that you're planning on using. But not only that, you also have to consult with your medical doctor or your neuropractic doctor as well. Comfrey root is possibly safe for most people when applied to broken skin in small amounts for less than 10 days. It's important to remember that the poisonous chemicals in comfrey can pass through the skin. Absorption of these chemicals is increased if the skin is broken or if large amounts are applied. So with any type of when you're using herbal supplements to heal, a sprain or to a broken leg, or um, maybe you had pain in your arm, pain in your leg due to arthritis or something like that. You want to make sure you're using the recommended dosage um, when you're using comfrey root. Some people just make a salve, and a salve is just like a cream that you rub on your skin. And I'm going to give talk about that as well. Comfrey is likely unsafe for anyone when taken by mouth. Why is it unsafe? Because it contains alkaloids, paralyzing alkaloids that can cause liver damage, lung damage, and cancer. The FDA has recommended removal of oral comfrey products from the market. So even though people say, okay, you can use comfrey root for coughs and different things like that. So the FDA has removed all types of products that are oil products pertaining to comfrey root. So you can't find no more products that are comfrey root for oral consumption. Those that are pregnant, breastfeeding, or lactating, comfrey root is unsafe. And even those women that are pregnant, lactating, and breastfeeding, you still have to check with your neuropractic doctor to make sure that the herbs that you're taking or the herbs that you're using are safe. There are a lot of herbs that are not recommended for women to use or you take due to the effects it could have. It can start premature labor. Some herbs can, if you're lactating or breastfeeding, because your child is a baby, you're breastfeeding, can pass from you to your child. Broken or damaged skin. Don't apply comfrey to broken or damaged skin. Doing so might expose you to large amounts of chemicals and comfrey that can cause liver damage and other serious health effects. Liver disease. This is a concern that comfrey might make liver disease worse. Don't use comfrey if you have any problems with your liver. So those y'all that have problems with your liver or any other type of problem with your liver, you don't want to use comfrey root. Now we're moving on to drug interactions. Major interactions. Do not take this combination. Medications that can harm the liver interacts with comfrey. So if you're taking medications for your liver, for liver damage or liver problem, you do not want to use comfrey root. Comfrey might harm the liver. Taking comfrey along with medication that might also harm the liver can increase the risk of liver damage. Do not take comfrey if you are taking medications that can harm the liver. Medications that can harm the liver include Tylenol and others, chlorine, isodides, Zocor, and many others. Moderate interactions. Be cautious with this combination. Medications that increase the breakdown of other medications by liver Comfrey is broken down by the liver. Some chemicals that form when the liver breaks down comfrey can be harmful. Medications that can cause the liver to break down comfrey might enhance the toxic effects of chemical contained in comfrey. So if you're taking medications that breaks down um, the liver, you don't want to use that as in a combination. Take using comfrey root. This is why it's so important to check with your medical doctor before you try any type of herbal supplements, herbal remedies, herbal modalities. Is so vital. Don't go out there and try, oh, I'm just going to try this and see how this works. No, it don't work like that. You always check. Oh, I read this and this is good for that. No, you don't want to just go off based on something you read. You want to check with your medical doctor. Why? Because your medical doctor has not some knowledge and understanding of herbs and how it can affect your body and how it can interact with the kind of medications that you use. Dosing: when you apply comfrey to your skin. For back pain, about 4 grams of a specific ointment containing 35% comfrey root extract has been applied 3 times daily for 5 days. About 4 grams of another cream containing 35% comfrey plus 1.2% methyl nitrite has also been applied 3 times daily for 5 days. For arthritis, about 2 grams of a specific ointment containing 35% comfrey root extract has been applied to the knee 3 times daily for 3 weeks. Also, about 3.5 grams of specific cream containing comfrey extract, tonic acid, aloe vera gel, eucalyptus oil, and frankincense oil has been applied to the knee 3 times daily for 6 to 12 weeks. For sprains, about 2 grams of a specific ointment containing 35% comfrey extract has been applied to the ankle sprains 4 times daily for 8 days. But anytime you're using any type of herbs, it's based on a person's age and health. Remember, when you're using herbal supplements, don't go on based on something that you read. No, you don't want to do that. You want to use herbal supplements based on, let me check with my medical doctor. Let me check with my neuropractic doctor. Let me check with my heart doctor. Let me check with my orthopedist to see if I can take this type of kind of herb, and if I can, will it interact with the medications that they prescribe to me? If I can, how much of it can I use? Can I make an extract out of it and then use it as a cream? Can I use it as, you get the essential oil and use it still as a massaging oil? How can I apply it to my skin? And you always want to know, when you're applying comfrey root to a sprain or back pain, you don't want to make sure you apply it to, if you have an open sore, you don't want to apply it to that open sore, because it won't be able to heal right. I was watching a video yesterday. The man was making comfrey root extract, but he was making sava, which is a cream or ointment to apply to like a sprain or back pain, things like that. And one of the things he said, if you have an open sore, do not apply it directly on the open sore, because when it heals, it'll just heal on the top, but not heal at the, inwardly, as open sore does heal. Anytime that we have a sore or something on our body, it heals from the outside, inside out. So it starts to heal on the outside, on the inside, and then forms a scab, because the healing took place from the inside. So he was saying not to apply it to an open sore or open wound, because it'll just heal on the surface and never heal on the inside of that open sore, that open wound, which can cause trapped inflammation. And when that happens, you have to be very careful. and that means you would have to go to the hospital. So anytime you try any type of kind of herbs, herbal supplements, dietary supplements, essential oils, you always want to make sure that you check with your medical provider first. I am Sharita, and I want to thank you all for joining me on today to Complementary and Alternative Medicine, Holistic Wellness, and Healing Blog Talk.